Hi, I'm Dr. Eileen Sables, and today we're going to talk a little bit about menopause. Hopefully, all of us will live long enough to get into menopause. Menopause wasn't talked about a lot around the turn of the century because most women didn't live long enough to live very long in menopause, but now we're living more than a third of our lives in menopause. This is a time when your periods cease, but your symptoms can start well before your periods actually cease. And the symptoms are legion. There are many, many symptoms. The commonest ones would be flushes and sweats, or flashes as they call them overseas. But also you can get headaches and joint pains and irritability, teariness, lots and lots of symptoms. I'm often asked, how long does menopause last? And that really is a how long is a piece of string question. Average is probably 2 to 4 years, but certainly I have spoken to people who have had symptoms for much, much longer than this. These can be alleviated by replacing some of the hormones that you lose. What happens in menopause is your ovaries stop producing your female hormones, your estrogen and your progesterone, so giving them back actually improves symptoms. Estrogen alone, if you still have a uterus, if you have not had a hysterectomy, you run the risk if you take estrogen alone of developing an endometrial cancer. So we do have to use progesterone as well to actually protect your uterus. Ladies who've had a hysterectomy can get away with just using estrogen to alleviate their symptoms. We are feeling very confident about using hormone replacement therapy for much longer than we used to. There are several different ways that we can give you those hormones. We can give you it entirely in tablet form, or we can split the estrogen and the progesterone apart and we can give you estrogen in a patch form, which is stuck onto the skin, and the patch is changed twice a week. And we have the chance then of varying the dose of the estrogen because some people will require more estrogen than others. The progesterone we give by mouth. If you are still having periods but require hormones, then we will have to phase this with your own menstrual cycle. So you will only take the progesterone for part of your menstrual cycle. If you've ceased having periods, and we don't say they're completely finished until you've had none for 1 year, then we can get away with using continuous progesterone. So that's 1 progesterone tablet every night. The progesterone that we use now, mostly Utrogestan, actually does assist with sleep in menopause. There can be symptoms related to the vagina and the vulval area, irritation, incontinence, running backwards and forwards to the toilet all the time. Sometimes using a topical cream that you insert into the vagina and put around the vagina will feed the tissues. The cream is estrogen, and you put a little bit of estrogen back into those tissues, and that can make a huge difference. There are many available over-the-counter preparations, and some people will get some benefit from these. Some are a mixture of minerals and vitamins. Others are plant hormones as well. So you do need to be aware if you're taking the plant hormone, even though you're not taking medicinal hormone replacement, you are still taking hormones. So you need to be aware of that and have regular mammograms. Although the previous studies did overemphasize the risk of breast cancer, there still is an increased risk of breast cancer if you are taking estrogen for a long period of time. So it is important to have regular mammograms, and even maybe more frequent mammograms than Breast Screen Aotearoa will provide. They will provide 2 yearly mammograms. You could think about having a yearly mammogram in between a private mammogram. Menopause isn't a disease that has to be treated. So staying fit and healthy, trying to maintain a healthy weight, looking after yourself mentally and physically, that can help support your menopause too. So it's not absolutely essential to take hormones.